Hello everyone, I'm Dr. Kavitha Kovi, consultant obstetrician and gynecologist based out of Whitefield, Bangalore. So there are so many channels out there which just gives you a lot of knowledge about pregnancy and the care of a pregnant woman. So why start another one? So I'm here to share my experience with all of you and also to impart that it's very important to have specialists caring for a pregnant woman. So I believe that pregnancy is all about teamwork. So when we start working as a team and providing a good care for a pregnant woman, it ends up with a beautiful experience for the mother. So what we call it as positive pregnancy experience. So I'm here to talk to you about the positive pregnancy experience and what perinatal or prenatal care is all about. In this episode, we will be talking about prenatal care and I'll be walking you through the overall journey of pregnancy. So what is prenatal care and why do we need to go see a doctor for prenatal care or the perinatal care or the care of the mother? So it's basically for two reasons: to have a healthy fetus and very minimal risk to the mother, or a healthy baby and a healthy mother and a happy mother at the end of the pregnancy. So when we talk about the positive experiences, so what is the positive pregnancy care? Positive pregnancy experience or positive pregnancy care is all about a woman going through a normal pregnancy, maintaining normalcy as much as possible, physically, culturally, socially, being very normal, near normal is what is all about positive pregnancy experience. And also about having a wonderful labor. That is where we assist you so that you have a very comfortable labor and also come out of the labor experience feeling, redeeming feeling very good about it, and also having your self-confidence go very high that you have achieved a normal delivery or a vaginal birth, or be it a cesarean section, but coming out of it positively and enjoying your pregnancy and having positive results out of it is called a positive pregnancy experience, right? So for a positive pregnancy experience, what is necessary? So a good prenatal care is necessary for a positive pregnancy experience, or there should be people to help you out to do that. So what is the goal of prenatal care? So the goal of a prenatal care is to have a healthy fetus or a healthy baby with minimal risk to the mother. So what are the parts or components of a prenatal care? So the prenatal care components can be, identifying the risk. The most important thing is, to know your history, to know the background, to know if there are any problems with you, and identifying the risks and trying to find solutions, and finally taking care of you carefully and giving you a healthy child. These are the goals of anticipating problems. These are the main goals of prenatal care. So we anticipate, we take your history, we help you out, we also anticipate problems and find solutions for it and help you through to have a wonderful pregnancy. So how does the pregnancy, how do you approach a doctor, when to approach a doctor, is all these confusions going on in everybody's mind. So I would then generally prefer if anybody comes prenatally, that means coming to the doctor even before you become pregnant for preconceptional counseling, that would be better. So coming and seeing a doctor to, to plan your pregnancy would be a better idea. But in case if you have missed it out, then obviously when you miss your period and you check your pregnancy test or home pregnancy kit, it turns out to be positive, and that's when your pregnancy journey starts, and that's when you start finding or seeking out a doctor. So once you go to see a doctor or visit the doctor, what happens in the first prenatal visit? So let me tell you, pregnancy is all about 40 weeks. That is equal to 9 months and 7 days. In some countries, they do wait till 42 weeks, but generally we say pregnancy is about 40 weeks. That is 9 completed months and 7 days. So that's also divided into 3 trimesters. The first trimester till 12 weeks, 12 to 28 weeks is the second trimester, and after 28 weeks stillbirth, that is till 40 weeks, is called as the third trimester. So during the first trimester or the first visit when you go to the doctor, so that is when the physical examination happens. The doctor would want to see your height, weight, your blood pressures, your BMI will be calculated, history taken. So any kind of problems in the family, so your history will be assessed, any genetic defects in the family, any surgeries in the past. All this is to identify any high risk factors. So that basically is about your first visit, where she'll also be prescribing you some prenatals so that it's healthy for the baby. Your diet can be discussed at that point of time. Any other queries or questions, I would always suggest that you can please write down your questions and come what it is that you want to know from the doctor. The doctor generally will keep explaining to you the first part of pregnancy, but journey. But still, if you get to your questions, then it will be easy and to the point conversations can happen so that you don't forget things when you go to the first antenatal visit. So during the first antenatal visit, also the doctor will be explaining to you about the number of ultrasounds you have, when are all the conditions when you have to come to the hospital. You may be seeing her in a clinic, but she will be giving you updates as to when you need to go see her in the hospital or in an emergency ward. So all this discussion happens in the first visit with the doctor. So the confirmation is by either by your urine pregnancy test, which you do it at home, or sometimes if you're confused, you do a blood test. So after that, at 7 weeks, the doctor will advise you for an early pregnancy scan. And in the early pregnancy scan, we see where the baby is situated, whether it's inside the uterus, what is the heart rate, whether there's any bleeding, any other comorbidities or risk factors are there inside the uterus, like a fibroid, or do we have cysts. All this we find out during the first ultrasound. So how many antenatal visits will be there when you see the doctor, or will you be seeing the doctor? Generally, in the beginning, you will be scarcely seeing her. You'll be seeing her at 7 weeks, 12 weeks, 20 weeks, but later once in 4 weeks, till 28 weeks of pregnancy, and later once in 2 to 3 weeks, you'll be seeing her. After 36 weeks of pregnancy, you will be seeing her weekly once till delivery. So these are the number of visits. Roughly, it will translate up to 14 to 16 visits you will be seeing your doctor. So the comfort level which grows between you and the doctor during that 14-15 visits is almost like family. So that's where you connect with your obstetrician and you'll feel very comfortable talking to her. So you can discuss what are all the discomforts which you're having. She can alleviate your fears. So it's very comfortable for you to talk to the expert rather than going through your Googles or searching for it or getting scared. So I would always prefer that women have regular antenatal visits so that it is helpful for them. So after 7 weeks of journey, then we try to see you at 12 weeks, where we do an NT scan, or it is called as the nuchal translucency. So this we try to find out whether the baby has any kind of syndromic associations like chromosomal problems, Down syndrome or trisomy 13 or 18. So we do certain blood tests also at that point of time. So we also rule out any thyroid, hypothyroidism, all the blood tests, Down syndrome tests, everything will be done between 7 to 12 weeks of pregnancy. So once we finish, we rule out that you're all fine, then you will be directly seeing the doctor at 20 weeks. So at that 20 weeks, we do something called as anomaly scan. Probably the doctor will be referring you to a fetal medicine expert. So in the next coming episodes, I may be talking to a fetal medicine expert who will explain to you in detail what is fetal medicine all about and what we are looking at, what is a fetal medicine expert and why do we need to see a fetal medicine expert in pregnancy. So at 20 weeks, you get an anomaly scan done, and the anomaly scan is going to tell us about the fetus completely, whether any physical abnormalities, any problems with the heart. Here I have to insist on and tell you that it is very, very important to do this ultrasound. Kindly do not miss your anomaly scans, or some places they call it as targeted fetal imaging or a TIFA scan. Please do not miss the 20-week scan. And afterwards will be your routine visits, where the doctor will be checking on you. And again, probably she'll ask you to repeat a growth scan at 28 weeks and another growth scan depending on the high risk factors in pregnancy. She may ask you for multiple scans or probably another scan just before your delivery. So when we are talking about the blood test, another test comes in the second trimester or probably the beginning of the third trimester, where we will be checking you for your sugar. So GTT test is compulsory. It all depends on how the timing of the GTT test depends on what the doctor wants you sees in you as in the history. If she thinks that you are a high risk pregnancy, probably she'll do it a little early. If she thinks that you're okay with it, the routine time to do a GTT is between 26 to 28 weeks, where you will be doing a sugar test, where strict instructions will be, guidelines will be given to you how to go about the test. And once we have achieved 37, 38 weeks, then probably you start your own labor, or depending on how many weeks it is and what is the condition, the doctor may suggest induction of labor. So when we are talking about a term in pregnancy, we call the terms, there are certain things like, let's talk about preterm labor. So we are all very scared about preterm labor. What is term? What is preterm? There are certain terminologies which are being used in pregnancy. So preterm labor consists of any delivery less than 36 weeks. If somebody delivers less than 36 weeks, after 24 weeks of pregnancy, it's called a preterm labor. So after 36 weeks to 37 weeks, now we call it as late preterm, or rather we call it as a late preterm. And 37 to 38 weeks, it's a term pregnancy, but we started coining it as early term. And after 38 weeks, it's a term pregnancy. And after 40 weeks, we call it as a post-dated pregnancy. So because we have given you an expected date of delivery, and after that, probably if you're crossing it, we call it as a post-dated pregnancy. So when we are talking about the expected date of delivery, that will be given to you by the doctor at 12 weeks of pregnancy. Sometimes at 7, or between 7 to 12 weeks, you have a fixed date. So it's very important in the first prenatal visit to give her the proper history about your menstrual cycles, so that she puts that together with the ultrasound and gives you a proper expected date of delivery. So it's very important that you see a doctor during your pregnancy and get your adequate prenatal care, so that you go through a wonderful labor and a beautiful delivery or a birthing experience. So in the next episodes, I will be talking to experts about nutrition, exercise. So it's always better than when experts come and discuss things with you. So nutrition, exercise, about analgesia, gastrointestinal problems, urological problems in pregnancy, what are all the complications that can come and how to deal with it, when to really see a specialist, the liver problems in pregnancy, all of this I'll keep discussing in the coming episodes. Thank you and have a wonderful day.